One of the great things about the State of Reform is it puts a lot of thought leaders together, not only as panelists, but just to talk with folks in the hallway and catch up. It's kind of a one-stop shop if you're in this industry to stop in for the day and catch up with people, hear what they're doing, hear what they've got going on. It's just great to have everyone in one place.
It's been great to listen directly from, for example, the leaders of the Department of Corrections, or listening to the commissioners and understanding what are the needs for Minnesotans and why that's different from a federal or another state. And so for me, I've been learning a lot, taking a ton of notes, and then also making connections and relevant conversations so that tomorrow we can look to say, how do we collaborate and partner in the future?
It was great to see the commissioner from the Department of Public Health here really understand when she brought up community and trying to how to really make an impact from the community lens and health equity. That's something that really speaks a lot to our company.
Folks closest to the community have their pulse on what the community needs. And so that plays out between state and our local partners. And so we are working together to make sure that as we address the foundational capabilities of public health, that we also have flexibility for local public health groups to implement those activities in ways that make sense for their residents and their people.
It's always good to hear what people are thinking, including people from other states. But I think, some of the topics are very specific. How do we meet the needs of culturally diverse communities? What are legislators thinking? What can we do in the early childhood space? What about some of the Medicaid waivers?
I like the diversity of topics. It's hard to choose which breakout to go to, which to me is always a good sign. And it's also a good mix of people, and they're very engaged.
It's intimate, so you feel like you're getting to know folks that are on panels, and there's a ease of approachment, and the broad stakeholders that are here.
I've been really impressed by what I've found here in Minnesota. I think it reflects decades of really important work and investment. I'm sure by a lot of people in the room, certainly by our team at DHS and the leadership there, and folks at the Healthcare Administration, to build really impressive programs.
I've met a couple of really great people from my panel that I'm like, I really like the way this person thinks, and I like the way I like the work they're doing, and I'm already starting to think about how can I use their perspective or the tools that they have and bring that into my own clinic, and that's pretty exciting.